species list. Biscayne Bay draws millions of tourists for boating, fishing, and snorkeling, and it is an important part of both our local and our state economies. Needless to say, at all levels of government, along with assistance from the private sector and buy-in from surrounding communities, protecting Biscayne Bay has to be a top priority. This means ending sanitary sewer overflows by making the necessary infrastructure improvements, increasing freshwater inflows to protect the many marine habitats that are currently threatened, and restoring the coral reef. To that end, I'm pleased to announce, along with Mayor Cava, a joint investment into the protection and preservation of Biscayne Bay of $20 million. $10 million will come from the state, and $10 million will come from Miami-Dade County. And in the coming weeks, the county and state will work collaboratively to identify worthwhile projects and pursue them without delay. In fact, Miami-Dade has already identified 6 projects totaling $5 million, and the state is putting in $2.5 million to cover the cost of those. And the funding will include important infrastructure updates and new technology to help predict and prevent sanitary sewer overflows. So thank you, Mayor. Thanks, NOAA, for helping provide the funding. You know, this is funding that we got as part of our water resources money. We got $625 million plus. This year we got a similar amount my first year in office, and this is the first time this particular pot of money has been appropriated, and so I think we're putting it to good use. Protecting our water resources has been a top priority since I became governor. We've secured over $1.25 billion for Everglades restoration and water resources protection over the last 2 years, which is a significant investment. We expedited and helped secure the required federal permit to begin work on the 6,500-acre stormwater treatment area of the Everglades Agricultural Area Reservoir Project, one of the most important Everglades restoration projects in history. The project provides significant ecological benefits, reduces harmful discharges to the St. Lucie and Caloosahatchee estuaries, and, importantly, sends more clean water south to the Florida Everglades. The AA Reservoir remains a top environmental priority for my administration, and we look forward to pressing ahead as quickly as possible. I've also directed the Department of Environmental Protection to purchase 20,000 areas of critical wetlands in the heart of the Everglades. This purchase was done to save the land from oil drilling, which was the plan of the previous landowner, but it's also going to be the largest wetland acquisition in a decade, or is the largest wetland acquisition in a decade. We've also invested $50 million in more than 20 statewide springs restoration projects to aid the recovery and provide additional protection for Florida springs. I also championed and signed comprehensive water legislation known as the Clean Waterways Act to minimize the impact of known sources of nutrient pollution, realign the state's resources to enhance the protection of Florida's environment, and strengthen regulatory requirements. This was created as a byproduct of my Blue-Green Algae Task Force, which we created one of the first days that I was in office. I also championed and signed legislation increasing fines for sanitary sewer overflows, as well as other environmental crimes, to deter bad actors and ensure environmental investments are safeguarded. We also moved the Environmental Crimes Unit from the Florida Fish and Wildlife Conservation Commission to the Florida Department of Environmental Protection to ensure proper enforcement of our laws. And finally, I made important structural and leadership changes to help ensure my administration was in the right posture to address current and future environmental challenges, and that includes replacing all the members of the South Florida Water Management Board. So there's a lot of work left to do. In this upcoming year, these are going to continue to be priorities as the legislature meets and we do the new budget. But I think that we have a groundswell of support throughout the state to continue making really strong progress on protecting our water resources and restoring our Everglades. And with respect to Biscayne Bay in particular, I want to continue to see healthy coral reefs, sufficient seagrass, and necessary freshwater inflows. And we will continue to work with folks in Miami-Dade County, including Mayor Cava, as well as my state agencies, to make that happen. So thank you. Mayor, would you like to say a few words?
Yes, please. Thank you. Well, thank you so much, Governor DeSantis. Thank you to our Lieutenant Governor, Jeanette Nunez, and our Department of Environmental Protection Secretary Noah Wallenstein. This is a great, great day for us here in Miami-Dade County, and of course, this incredible paradise that we call home. We are making a critical investment in our community and in the future, especially of our beloved Bay, which is our lifeline for our economy and our health. It's the western shore of our beautiful Bill Baggs State Park right here, Biscayne Bay. It's the jewel of our South Florida environment and our regional economy. Oh, I'm going to take off my mask. So it's not an overstatement to say that our entire economy and our community's prosperity depends upon access to clean water. In recent years, we've seen the tragic near collapse of Biscayne Bay, the result of nutrient pollution, our historic over-reliance on septic over sewer, and our aging water infrastructure. We've seen the impacts of this crisis firsthand, especially in recent months. Our seagrass meadows are in retreat. There are algae blooms that are plaguing the formerly crystal clear waters, and the fish kills were literally bringing the crisis off our shores vividly to the surface all too recently. And our beautiful coral reefs are in jeopardy as well. My administration is committed to taking urgent action to reverse the damage, save the Bay, and preserve our environment and economy. And today I am thrilled that we are able to announce this new funding from the state that will be pivotal in helping us to tackle this crisis head on. The good news is that we have a plan of action to guide us forward through the important recommendations of the Biscayne Bay Task Force. And just last week, we released 2 additional key reports that will help move us towards solutions. The first is a septic report that gives us a tactical approach for how we're going to identify the most urgent and most effective places to start converting our homes and businesses off of septic and connecting them to our sanitary sewer system. And the state will also be very important partner in making sure that we target those investments to help us accelerate this transition. And we also released our first annual Biscayne Bay report card, and our report card is designed to help the public clearly understand the health of Biscayne Bay in different parts most affected by the pollution, and it will keep our government accountable every year with this annual report so that we can showcase the progress we are making to save the Bay. A critical part of our marine ecosystem is our coral reef. As was mentioned, we're the only place in the United States, continental United States, with a coral reef. We are blessed. It's a tremendous value ecologically. It's also a powerful contributor to our economy, and it quietly works to protect the life and property by absorbing the power of incoming storms. So it's an important feature of our hurricane strategy as well. And the counties of Southeast Florida have banded together to work with the state to address this mysterious disease that is plaguing the reefs, the stony coral tissue disease. It has devastated the reefs, and the funding announced today will go a long way towards restoring the health of our coral ecosystem that is so critical to the health of our bay and ocean. And so we're taking an important step today towards the saving of our bay and of our reefs. So on behalf of Miami-Dade County, I want to thank Governor DeSantis, Florida Department of Environmental Protection, and our Lieutenant Governor for their commitment to facing the urgent threats facing our ecosystem in partnership with us here in the Miami-Dade County. You're making much needed investments to protect our environment, our economy, and our public health for now and for the future. Thank you. Thank you very much. Secretary.
Thank you very much. My name is Noah Wallenstein. I have the privilege of serving as Secretary of the Department of Environmental Protection here in Florida, and thank you to the Governor, Lieutenant Governor, and Mayor. What a team. Growing up and certainly with the team at the Department of Environmental Protection, our lives are protecting the environment here in Florida. In the 1970s, you saw a real large environmental movement start nationally and sweep the nation. And as professionals working in this area, we always talk about that. A lot of us grew up watching that, and that inspired us. Right now, we've got an environmental movement that's going to sweep the nation, but it's starting here in Florida. In 2018, so much began to start happening for the environment that we sometimes have to pinch ourselves at the agency. So as the governor mentioned, just in the last year, we had landmark legislation that gave our agency 50 to 100% increase in environmental penalties across the board. We now get to talk about Everglades restoration projects, not in terms of decades and will the project happen, but now with the EAA Reservoir, we actually started design of that project and broke ground in less than 3 years. This is a great time to be working on the environment in Florida and something we're all thankful about. Protecting our coral reef system here, again, the third largest barrier reef system in the world, one of Florida's crown jewels of environmental resources, is so key. And again, that's another great demonstration of what happens when you have a partnership like there is behind me, is we saw the outcome of poor water quality and impacts from runoff from an urban area this summer with a fish kill. And so often in the past, you wouldn't see movement, or there would be a stall, there would be questions, but you wouldn't see action. Right now, we're already standing here ready to invest in a solution because the governor had already lined up having funding for the environment and making it a priority, and because we have local partners that care and are willing to join together, follow the science, and take action. And so on behalf of the Department of Environmental Protection, it's a wonderful time to work on the environment. We're making great progress, and we're excited to ensure that Biscayne Bay is preserved for generations to come.
You know, one of the things that that I would tell Noah and just tell our guys as we were fighting for the funding was, particularly when you deal with things like Everglades restoration, the state has to show we have skin in the game. We wanted to come and lead the way, provide resources, so that when I went to Washington, I could say, we're not asking you to do this for us. We're here. We want you to help us, but we're gonna work hard. And I think when you're willing to do that, it makes a difference. And so for Miami-Dade to be able to say, absolutely, we have skin in the game, makes it very easy for me to then work and say, of course, let's work together and get this done. So I appreciate your commitment. And thank you for working very hard on this. And we're going to continue at it. This is just so important. You know, every time I fly into town and we kind of take the route when you go out to the Atlantic and then come back, I mean, it's really awe-inspiring. It's a great part of the Florida and a great part of the country. And with that, Glenna. Hi. Sure. Well, so it's both. So so we wanted $625 a year on average for water resources, including Everglades. So it's not $625 all for Everglades. And so some of the other septic sewer projects and all this, anything that's getting our water quality better is included. This particular money was a part of the $625 plus we got this year, and it was initially set aside to kind of be a Springs pot of money. But I think as it worked through the legislative process, Noah, they then added, hey, let South Florida get involved with it. And so this was really the first time any money like this has been used. So I think it's been successful, and we're happy to be able to do it and to make an impact with it. Yes, sir.
Some local leaders in Miami-Dade have said they've had some trouble reaching your office to talk about COVID prevention efforts. I'm wondering if you've had a chance to speak with Mayor Cava or Mayor Suarez about some of their concerns.
No, I told Mayor, I said, I congratulated her on her win and said, I'm willing to work with you on whatever we can to help the county. This is an important part of our state. You know, she's a strong mayor of a county that's bigger than like probably 20 states in our country. And so it's really, really significant. You know, I told her that she ran on a certain platform and she's going to pursue that. And if I don't agree with everything, I'm not going to come nitpick on that. I'm going to find examples where we can work together. So our door is always open. And in terms of some of the COVID, we discussed, and I know Glenna may want to talk about some of the vaccine, but what we did in the initial Florida, so the priority was long-term care residents because they're the most vulnerable, and then really the tip of the spear, healthcare workers for that first shipment. And the thought behind that was they're in high contact with COVID folks. If you have a bunch of them get infected, then our hospital capacity goes down. So we wanted to knock that out. Florida was the first one to be in nursing homes. Most of the other states aren't even starting until, I think, today, and some of them not even till the end of the month. So we did that. We worked with Pinellas and Broward because they had a lot of stuff, but we also had some facilities in Dade who were able to handle it and administer it. So we work with that, and I told the mayor, if there's more facilities, if we can send more strike teams, we want to do that. We want to be helpful as it becomes. You know, we're getting today about 61,000 doses of the Moderna are going to arrive today, is what we're tracking. And then tomorrow, so 61,000 today, and I think tomorrow is going to be over 300,000. And so that's going to go to over 170 hospitals throughout the state of Florida. We're also going to get, I believe it's about 120,000, somewhere in that range, of the second shipment of Pfizer. And so we expect that to come either today or tomorrow. So all this stuff is in shipment, and our goal is to be able to get it out for folks who are able to help the people as best they can. I was able to go to, we were in Pompano Beach, and we had some of the first seniors be able to get it. And it was really great because they've done a great job there. But it's been tough because obviously you're worried about a pathogen that could affect very frail and elderly people, but you're also worried about quality of life and having all this mitigation and just not being able to kind of live out some of your final years in ways that are the most fruitful. So I think the vaccine provides a way not only to prevent folks from obviously a serious pathogen, but hopefully opening up that window of returning to normalcy and really thriving as seniors. But I had folks from the nursing home community tell me when the vaccines, when these strike teams started showing up at some of these facilities, you had people with tears in their eyes because it's like, finally, you know, we have some help on the way in a way that can get us beyond the mitigation. Do you have vaccine?
So those were 112 long-term care facilities that Broward and Pinellas for your first. I believe last week you said that Walgreens and CVS were starting that federal portion of the rollout of long-term care today.
Well, yeah, but you know what happened was, because we said there's no time to waste, Walgreens agreed to start on Thursday, so they moved it up.
So how were those initial 112 facilities chosen? Is there something special about them? I looked for
It was just because if you look at Pinellas and Broward have a high concentration of skilled nursing facilities, and so we were basically trying to find, okay, where can we get the most bang for the buck, make the biggest impact? Pinellas in particular has had some problems with outbreaks, and so we felt that that was something that was good. But we absolutely are going to be moving on the other counties with the strike teams, and then having CVS and Walgreens doing their part. That's going to continue as well. We just, my view is we want this to go as quickly as possible. I mean, obviously, there's a lot of due diligence that goes into this. Our folks, ACA, Department of Health, Emergency Management, they were working with the facilities weeks ago. As soon as the news of the Pfizer came, we got into gear and said, what functionally do we need to have happen? Well, when you're in a nursing home, not every nursing home resident is capable of consenting. They have people that consent on their behalf. So we wanted all that lined up to know, okay, if you can't consent, are you going to have the third party make a decision one way or another? So they've been plotting the ground, and they focused on those two counties to start.
And are you confident that CVS and Walgreens will have enough staffing, or will the states have to supplement that federal program?
So, well, it just depends on what you mean by enough. I mean, I know they have a lot of folks. They do this as a matter of course with the flu vaccine and the flu shots. So they have folks mobilized. Obviously, they're under contract. So I think they have a lot of people and they have a lot of resources to bring to bear. But I think what we're just going to continue to do until all the facilities have been visited is just keep our strike teams out there. So if you have CVS and Walgreens doing something on Key Biscayne or other parts of Dade County, but maybe no one's in Hialeah, maybe we send people to Hialeah. So we're just going to continue to work. My strike teams, I've already told them, you're active and you're involved in this until all seniors in long-term care facilities have been offered the vaccine. Now, not everyone wants to take it, which is fine. I think what you'll see is when we went to the first ones, there was a certain number of people that wanted it. Then as more people got the shots and it was fine, then people that day said, I want it. And then I think what you'll see is as more and more days go by and people realize that it's safe, then I think you'll see even more people sign up for it. Yes, sir.
Governor, regarding the vaccines in hospitals specifically, I'm wondering what your thoughts are on which hospital workers specifically should be getting them now. Should people in more administrative roles in hospitals who aren't necessarily working with COVID patients day to day be getting them now or waiting
Yeah, no, I would say, we talk about the front, like the high contact, high risk folks. So obviously any nurse, ICU doctors, ER, but it's not just that. I mean, like Carlos Magoya made a good point. He's got some of the food service workers who service COVID because they're in contact and they can spread it. So, but I would definitely say it's kind of that more tip of the spear version. And the reason why is just because that's going to help keep our hospital capacity up. There's never been a problem with beds in the United States that I could see. I mean, even New York didn't use the Javits Center. But what you do have is, one, it's very taxing on staff to do COVID because of all the isolation procedures. But if you have a staff member get infected and they expose a dozen other nurses, well, then you're having to isolate a lot of people, and that creates shortages potentially in staffing. So we feel this is a way to really shore that up. But once you've kind of gotten that initial one, and then we're doing the long-term care, our view is we really need to get it out to the elderly population. Now, some of you may have seen there's an advisory committee that advises CDC about priority setting for the vaccine. And they came out with something over the weekend that got a lot of blowback, and I think rightfully so, where they were going to prioritize essential workers over elderly. I think that's a huge mistake. They've had to walk back from that. Their recommendation in front of CDC right now is 75 and plus and essential workers are the next round. The problem with that is, as I see it, is a 22-year-old food service worker would get a vaccine over a 74-year-old grandmother. I don't think that that's an appropriate calculation of the relative risks there. So that is going to be presented to CDC. I don't know if they're going to approve that or not. I'm going to have a full statement tomorrow about how Florida is going to approach this kind of next phase once we get beyond the long-term cares and the frontline nurses and docs tomorrow. But suffice it to say, our whole strategy around COVID has always recognized the dramatic discrepancy in risk based on age. And so if you're trying to mitigate based on age, surely you would want to vaccinate based on age. And there's been some great analysis done to show that if you vaccinate the bulk of the 70-plus population, the mortality on this goes really, really down. And so that's really, I think, what we're looking for. And so I'll have a full statement on that tomorrow. You have anything else before I go?
That was actually going to be my next question. So does the state, what's the protocol with the CDC and taking the recommendations of that panel?
Purely advisory. And they say that. They say states need to be able to make their own decision. And I think a lot of people would understand, just given our demographics. I mean, we have one of the highest percentages of 70 and plus in the country. And so I think people would understand why we would want to do that. But I also think the data justifies that. I mean, the fact is the mortality amongst essential workers is a fraction of what it is in the senior population. And so the more you're able to provide the protection to senior citizens, the less stress you have on hospitals, and obviously the more lives you're going to save. The initial analysis that was done by this committee that had to be kind of reeled back actually conceded that if you do essential workers first before seniors, you're going to have greater mortality. And I just thought that was ill-advised. I think they understood that it was ill-advised. But at the end of the day, we're looking at probably take away what we've already received, maybe another 750,000 doses by the end of the month, maybe a little bit more between Pfizer and Moderna, and then hopefully 1.5 million to 2 million doses in January. That can do a lot in the 70-plus population. If you're going to try to do every essential worker, that's not going to be nearly enough for what you would need anyways. And so you'd be focusing on lower risk populations and not even do it, I think, in a way that would be fully effective. So we'll have a full statement on that for you guys tomorrow. It's something that's very important, and it means a lot to me to make sure that we're putting our parents and grandparents first in all this. I think if you asked anyone, if you took a 25-year-old sheriff's deputy somewhere in Florida and said, I have one vaccine, do you want it, or should I give it to your parents or grandparents who may be over 70? I think 99% of them would say, oh, no, give it to the grandparents, give it to the parents. Thanks, guys.